Tansa ntutemtik. Nigananas kamamawatawimaw. Asimi nakutak kisagak mamuwiwia. First and foremost, I'd like to acknowledge you, the members of Kihiwan Cree Nation. I'd like to provide a very important announcement to you so that we can, do our due diligence on providing updated information on the current situation we're dealing with, this pandemic, COVID-19. On Friday, September 18, 2020, we received a phone call from AHS delivering the message that we had our first COVID case. And I guess all these months that we've been preparing with the emergency management team, the director of emergency management, we've taken the steps, we've practiced, we've gone into a lot of scenarios on how to deal with COVID-19. We knew it wasn't a matter if, but when it was going to come to our community. We all know that announcements being out there from the province, even the federal, that there was a second wave coming. And I mentioned it in my last announcement that around September was the second wave. We're starting to see a lot of it around our communities. Neighboring nations are going through it. And basically, we are all in this together. We cannot address this COVID-19 on our own. We have elders to look after, we have our youth to look after, we have our members, each and one of you, to take care of each other. I wanted to highlight some points that we've done in the last few days. We had a leadership emergency management team meeting on Saturday, September 19th. And basically we've enacted a couple motions so that we can look out for the safety of our community. And basically the motions, the 5 points in the motion. First one, that we immediately shut down all public buildings in our nation. Secondly, we also canceled all the social distancing events until further notice. Third, we've enacted mandatory masks in all public areas in our community. And again, that's for our safety. As well, the meeting that we had for our emergency management team, our first initial one was face-to-face, but after discussion, we've determined that future meetings that are going to take place between leadership and emergency management will be done by way of conference calls. As we know, we've been doing tracking and tracing. That's been underway since Friday. To date, I think we have 165 tests that were done since Friday. So those are all pending, and hopefully we stay on top of it. As well, leadership also discussed our involvement in meetings off the reserve. As we know, leadership, we do the business, day-to-day operations and business for the nation requires us to meet with other organizations, other levels of government, so that prompts us to lead the community. So we've decided and agreed collectively that we do monthly testing for ourselves. But in the meantime, we have rescheduled quite a few of our meetings. So hopefully for the next 2-week period. And at the same time, we discussed extending our state of local emergency. We had a meeting on September 15th, and we again collectively agreed to extend it to December 15th, 2020. and there we'll reevaluate and review. I guess also with the school, when we met back in July, August, talking about the re-entry plan for the school, we had a health manager as well as the the principal from our school, meeting with leadership. We've done a couple meetings on that re-entry plan, and we decided to hold off on the in-class instruction. And basically, for the month of September would be cultural and land-based teachings. We did do the first 2 weeks in September of those, I guess, the events that were taking place. But once we found out with the first confirmed case, we've now canceled the rest of those activities. And we also closed the school down until October 15th, when we'll basically reevaluate and review the re-entry plan for our nation's school. And then I guess to add to that, the message I want to get to you, the members, is that we are in the middle of a tracking and tracing procedures. With our first confirmed case, I encourage you to comply with the health management and staff. We need to stay on top of this. You need to realize you need to protect your family, the elders, the youth. We are a small community, well connected, but at the same time, when we have our first case here in Kihiwin, we need to be able to respect each other. We need to be able to, I guess, look after our elders. We have 116 elders in this community over the age of 65. 70 live on the reserve, 46 live off reserve. And so I again encourage you as members to comply. If you have been contacted and being identified as somebody that has been in contact with that individual, please do the test so that we can stay on top of this and we can end this COVID in our community. Also wanted to add, with our health center, we are doing drive-through testing commencing tomorrow, which is September 21st. And we encourage all the families to come, and there will be signs posted, and I encourage all the members to come and get tested. That's the only way we're going to stay on top of this. As well, I know we have another epidemic, and this is a very touchy issue, not just in Kihiwin, but other communities. And that's the drugs that are being in our communities. We know it's been a pandemic within a pandemic, and it makes it more harder for our frontline staff to deal with the situations. And I guess this is the message that I want to also put out in the community, that our people, this is a dry reserve. We have to respect our community. And if we want to build a better community, we need to make sure that those drugs that are harming, they're killing our families, our people, that they stay off the reserve. I get a lot of calls, concerned mothers, crying mothers, concerned Kokums and Muslims calling me about the situation, how it came to be. And I think we need to come together and address the drugs in our community. It's hard to deal with that, especially when we're in a COVID situation. But I hope that we, through working together, looking after one another, that we can address not only COVID, but the other pandemic that's hit our community. We don't need it here. It wasn't here before. And we need to work together to get it out. And with that, I want to thank you for hearing my message. And I pray that everybody is safe in their own homes. And also to remind, when you're out there traveling, to be mindful of where you're going and who you're connecting with. We are very social people. We like to visit. We like to go through events in other communities. But now is not the time to I guess, be doing that right now. I think we need to make sure our community is safe and look towards that time when we'll be COVID free. But with that, in closing, I wanted to acknowledge all our frontline staff, all the people that are working together to help keep you safe. And with that, I want to thank everybody, elders, elder prayers, everybody in our community. With that, hi, anaskumten.